Good evening. My name is Kelsey Farmer, and I'm an exercise physiologist here at KSB Hospital in the cardiopulmonary department. I'm going to briefly discuss what cardiac rehabilitation is and how exercise is beneficial for cardiac health during February being Heart Health Month. So, what is cardiac rehab? Cardiac rehab is an individualized exercise program ordered by a physician designed to improve cardiac health and improve in recovery from cardiac event. This is designed for post-cardiac event individuals, and that will be discussed later on in the presentation. It consists of a mixture of strength training, cardiac exercises, and stretching exercises that can be used in the program and used at home after the patient graduates the program. The maintenance program is the non-monitored phase 3 program. That is a post-program after a patient completes phase 2, which is a 12-week program monitored by staff using EKG, electrodes, blood pressure readings, heart rate, and oxygen. This is generally covered by most health insurance. However, phase 3 is a self-pay program. The conditions and procedures that do qualify for cardiac rehab as a post-cardiac event are heart attacks within 1 year, congestive heart failure diagnosis, coronary artery bypass surgery, heart transplant, balloon angioplasty or a stent in a main heart artery, and stable angina, all diagnosed within 6 months. The different types of cardiac rehab and how they work. Phase 1 is an inpatient referral from the physician post-cardiac event to our cardiac rehab program. We get the referral from the cardiologist post the cardiac event. We mail out some information for the patient and wait for a response if they are interested in the program. If we do not hear anything within a week, we reach out to the patient if they are interested. Phase 2 cardiac rehab is a monitored cardiac rehab program. This is typically covered by most insurances. It's an outpatient program here at KSB in Commerce Towers, and you do have to have a referral from a physician, also post-cardiac event. It consists of 36 sessions every Monday, Wednesday, and Friday, so 3 times a week for about 12-week program. And it's designed to improve the heart muscle and build strength up post the cardiac event. Phase 3 cardiac rehab is our outpatient program, also referred by a physician post-cardiac event. However, this is a maintenance program, so can be a lifelong program. We have patients that have been doing phase 3 over 20 years, or some that just decide to do it for a little bit after a phase 2 program. We help them in this program design a program they can use at home. Typically, it follows phase 2 cardiac rehab program, but it does not have to. I'm going to have my colleague and coworker, Lindsay Hart, who is also an exercise physiologist here in the cardiopulmonary department at KSB, talk about the importance of exercise in our presentation.
Hi, I'm Lindsay Hart. I'm going to discuss a little bit more on cardiac rehab. I'm going to start on the topic of the importance of exercise. Exercise is important for all populations, but it's especially important in those with cardiac problems or a history of cardiac events. How it kind of improves the body is it improves brain health, improves emotional health, helps manage weight, promotes better sleeping habits, it strengthens bones and muscles, and it also reduces the risks of other diseases. It also reduces the risks of another cardiac event from occurring. It increases energy levels, and it improves blood pressure and cholesterol. A lot of the patients we see start our program with high blood pressures and resting heart rates, and they leave with a much better blood pressure along with the heart rate that's a lot lower. So what a typical day in cardiac rehab looks like for one of our patients is they come in, they check in with Commerce Towers, and then stop up and talk to any staff, kind of tell us if there's any medical changes, how they've been feeling, any issues we discuss with them. From there, we have them sit down and we check their vitals. We do blood pressures, we check their oxygen, and then we weigh them. If they're diabetic, we take their blood sugar as well. We weigh them each time, and then we get them hooked up to our 3-lead EKG monitor. From there, they come out and check with whoever's behind the monitor to just see how their heart rate and rhythm is looking before we get them going on exercise. From there, if all looks good, we have them exercise on 3 of our machines that is set by the exercise physiologists. So levels and duration are all set by us. And then we monitor them as they exercise on these machines. So we take their blood pressure halfway through a machine. We have somebody watching their heart rate and rhythm all through exercise, as well as just seeing how they're feeling. We use a scale called RPE, which is how hard they're working essentially. And we kind of use that to set their different levels. When they're done with exercise, we have them sit and kind of just relax a little bit. And then we do ending vitals to make sure those blood pressures and heart rate came back down to where it started at. Every once in a while, we will have them sit in for an educational session that can include diet, exercise, cardiac history, and events, all that. So they are a little bit educated along with the exercise they're getting. So we asked our cardiac rehab patients to anonymously just leave us some quotes about how cardiac rehab has improved their life or health. So I'll read through a couple of those here. The first one said, "It was helpful when I had my knee replacement. 6 months coming to rehab made my knee stronger and physical therapy easier. A lot of the patients we see go over for a stress test thinking they're going to have knee surgery, hip surgery, something along those lines, and need pre-op clearance for these surgeries and actually find out that they have something wrong with their heart. So they come to cardiac rehab from there, and it actually does help when they do eventually have those knee surgeries or hip surgeries or whatever they were getting cleared for." Another patient said, "It has increased my SATs with oxygen or her oxygen, lowered my blood pressure, and improved my general fitness. 10 years out from bypass surgery, I continue to do well. I owe that to rehab." Next one said, "I have much more energy and the staff is outstanding." A lot of the patients we do see kind of come in a little bit more shy and tired, and they tend to improve in the energy and mood wise. Another patient said, "I feel stronger twice a week. Cardiac rehab is good. I do other things like weightlifting and exercise for the core. Consistency with exercise is good for building strength and endurance." Kind of those long-term patients really see the importance of exercise as the longer they come, the more important they realize exercise is for their health. Another one said, "The program helped me realize the degree of exercise I could do and be able to tolerate it, and knowing I was being monitored was a comfortable feeling. I'm motivated after being in the program to continue exercising on my own, knowing what I'm able to do now. Good program, good staff." All right, and that is all we have. If there's any further questions about anything we just talked about or cardiac rehab, feel free to reach out to us at cardiac rehab at KSB Hospital. Thank you guys for joining us tonight.